These 13 herbal teas have been quietly doing medicine for millennia, and now science is starting to map out exactly how they work. Some of them can deliver surprisingly fast symptom relief. Others are daily tonics that reshape your baseline health over weeks. Instantly in the title is a promise with a footnote. I'll point out which ones tend to relieve symptoms quickly and which ones build benefits over time. No miraculous guarantees, just evidence, practical brewing, and safety notes so you can use them smartly. Quick preview. Today we'll move from antiviral elderberry to blood pressure-friendly hibiscus. And along the way I'll flag the 2 teas I want you to remember. Clove of 7, which targets the same COX-2 inflammatory pathway as some NSAIDs, and turmeric, one, whose effects explode when you add black pepper and a little fat. If you want more evidence-backed natural health guides like this, hit subscribe and like. I post step-by-step brewing demos next week. Number 13. Elderberry aroma and look, deep, dark purple, almost wine-like, with a tart, berry-forward taste that finishes a little floral. A bit of history. Across Europe, Africa, and the Middle East, people have cooked and sweetened elderberries for centuries to treat colds and flu-like illnesses. What the evidence says. Randomized trials comparing elderberry syrup to placebo in people with influenza-like illness have found shorter duration of symptoms, roughly a few days less of sickness in some studies. Mechanistically, compounds in elderberries seem to interfere with viral entry and stimulate a coordinated immune response, enhancing certain antiviral cytokines without necessarily provoking harmful overreaction. How to prepare. Use dried elderberries or a properly prepared syrup. Cook dried berries in water for at least 20 minutes to break down toxins present in raw berries, then strain and sweeten lightly if desired. Typical home method. 1 cup dried elderberries to 3 cups water, simmer 20-30 minutes, then mash and strain. When it helps and cautions, elderberry can shorten symptom duration in many acute upper respiratory infections. So it's a short-term, targeted intervention rather than a lifelong tonic. Important safety note, do not eat raw elderberries or leaves. Always cook them. If you take immunosuppressants or have autoimmune disease, check with your clinician before regular use. Pregnant or nursing, consult your provider before use. Number 12. Passion flower. Aroma and look. Delicate, slightly grassy with floral overtones, a mellow, honeyed bitterness on the finish. A bit of history. Used in traditional European and Native American herbal medicine as a gentle nervine, a plant that calms the nervous system. What the evidence says. Several randomized, placebo-controlled trials report improvements in generalized anxiety and sleep quality with standardized passion flower extracts. The likely mechanism is modulation of GABAergic signaling. In plain language, passion flower contains compounds that gently boost GABA, the brain's main slow-down neurotransmitter, and that helps reduce racing thoughts and promote sleep onset. How to prepare. Steep 1 to 2 teaspoons of dried passion flower or 1 heaping tablespoon if loosely packed in a cup of boiling water for 12 to 15 minutes to extract the calming constituents. Longer steeping works well here because the active compounds are water-soluble and release more with time. When it helps and cautions, best used 30 to 45 minutes before bed for sleep or any time you need a calming ritual. Use as a short course for acute anxiety or nightly for a few weeks to judge benefit. If you're on benzodiazepines or other CNS depressants, consult your prescriber because combined effects can increase sedation, pregnant or nursing. Talk to your clinician first. Kids, check with a pediatrician before use. Number 11. Chamomile. Aroma and look. Pale gold. Apple-like sweetness up front with a soft floral finish. It smells like a warm kitchen. A bit of history. One of the world's classic calming herbs, used across Europe and in Middle Eastern traditional medicine for sleeplessness, digestive upset, and mild anxiety. What the evidence says, Clinical research points to chamomile's active molecule apigenin binding to GABA receptors, producing mild anxiolytic and muscle-relaxing effects. Small trials show modest improvements in sleep quality and reductions in generalized anxiety symptoms, and some evidence supports chamomile's role in easing mild digestive cramps by relaxing gut-smooth muscle. How to prepare? Steep 1 tablespoon or 1 standard tea bag of dried chamomile flowers in boiling water for 8 to 10 minutes. A longer steep releases more apigenin, but also intensifies the flavor. Taste to preference. When it helps and cautions, chamomile is often fast-acting for sleep onset and digestive relaxation. Many users feel the effect within 20-45 minutes. It's generally safe, but if you have severe ragweed or aster family allergies, be cautious because chamomile is related and can trigger reactions in sensitive individuals. If you take sedatives, consult your provider. Number 10. Ginger aroma and look. Bright, spicy, warming, with a peppery bite that lingers. A bit of history. Ginger has thousands of years of use in Ayurvedic, Chinese and European folk medicine for nausea and digestive complaints. What the evidence says, ginger is one of the better supported botanicals for acute nausea. Randomized trials in context from motion sickness to chemotherapy-related nausea and pregnancy-related morning sickness demonstrate clinically meaningful reductions in nausea intensity. Mechanistically, gingerols and shogaols act on both peripheral gut receptors and central nausea pathways in the brainstem, helping to quiet the signals that create queasiness. How to prepare? For fastest effect, use fresh ginger. Slice a 1-2-inch piece of fresh root into thin coins and simmer gently in 2 cups of water for 15 minutes. Strain and sip warm. For a stronger brew, grate a teaspoon of fresh root into boiling water and steep. Candied or concentrated extracts work for portability, but check sugar content if you're using them frequently. When it helps and cautions, ginger often gives rapid symptomatic relief for nausea. Many people notice improvement within 20 to 30 minutes of a hot ginger infusion. It can also be used regularly for its mild anti-inflammatory effects, but for persistent or severe vomiting, seek medical care. If you take anticoagulants, check with your provider because ginger may have mild antiplatelet effects at higher doses. Pregnant or nursing, talk to your clinician. Ginger is commonly used in pregnancy, but dosing details matter. Number 9. Peppermint aroma and look. Piercing menthol top notes with a cooling sensation that clears the tongue and the chest. A bit of history. Peppermint leaves turned into teas, poultices and inhalations for centuries in European and Middle Eastern folk practice, prized for digestion and breath-clearing properties. What the evidence says, multiple randomized trials and meta-analyses support peppermint oil and peppermint tea for irritable bowel syndrome, IBS symptoms, especially pain and bloating. Menthol relaxes gut-smooth muscle via calcium channel modulation and transient receptor potential TRP channels, reducing spasms in the intestines. Ingested peppermint can also ease tension headaches in some people via vascular and neural modulatory effects. How to prepare? Steep 1 heaping teaspoon of dried peppermint leaves or 1 tea bag in boiling water for 8 to 10 minutes. For a more intense cup, bruise the leaves before steeping to release essential oils. When it helps and cautions, peppermint tea is often fast-acting for crampy gut pain and bloating. People commonly feel relief within 15-30 minutes. Avoid peppermint if gastroesophageal reflux, acid reflux, is your main problem, because peppermint can relax the lower esophageal sphincter and worsen heartburn in susceptible people. If you're on antacids or reflux medications, monitor symptoms and check with your clinician. Number 8. Hibiscus. Aroma and look. Bright crimson color, tart like cranberry or sour cherry, refreshing iced or hot. A bit of history. Hibiscus petals have been turned into tart infusions in Africa, the Middle East and the Caribbean for centuries as cooling beverages and tonics. What the evidence says, well-designed, randomized, controlled trials show that regular hibiscus consumption, typically 2 to 3 cups daily, can lead to modest but clinically relevant reductions in systolic blood pressure over several weeks. The effect is thought to come from anthocyanins and other polyphenols that can act on vascular tone and exert mild ACE inhibitory activity. In plain language, hibiscus helps blood vessels relax and can lower pressure modestly when taken consistently. How to prepare? Steep 1-2 heaping teaspoons of dried hibiscus petals in a cup of boiling water for 5 to 10 minutes. It makes an excellent iced tea. Add a bit of honey or citrus to soften the tartness. When it helps and cautions, hibiscus is a cumulative intervention. Expect to see measurable blood pressure effects after days to weeks of daily use, rather than instant relief. If you take antihypertensive medications, consult your healthcare provider before starting regular hibiscus tea, because combined effects may lower blood pressure further. Pregnant or nursing? Talk to your clinician before use. Pause for a moment. Those 6 give a good sense of how different teas fit into 2 broad patterns. Elderberry, ginger and peppermint can act quickly in acute situations. Elderberry can shorten respiratory viral illness duration when used early. Ginger calms nausea rapidly, and peppermint eases spasms in the gut fast. Chamomile and passion flower tend to be fast for sleep and anxiety onset too. Hibiscus, by contrast, is a classic build-it-into-your-routine tea. Not an emergency cup, but a daily habit that nudges a measurable physiological parameter, blood pressure, over time. If this breakdown is already useful, take a second to subscribe. I'll post short, how-to videos showing exact simmer times and the visual cues that tell you a brew is ready. Number 7. Clove. Preview. Sensory teaser, warm, intense and aromatic. A little goes a long way. Why highlight it? Eugenol, clove's signature compound, targets the COX-2 inflammatory pathway, the same pathway many NSAIDs affect. That doesn't make clove ibuprofen in a jar, but it does help explain why a clove infusion can rapidly reduce localized inflammatory pain and have antimicrobial benefits. What I'll cover next: exact steeping time, how to use clove safely, bleeding risk with anticoagulants, and sensory pairings so it's palatable as a tea rather than a spice bomb. Number 6. Thyme. Preview. Sensory teaser, rosemary adjacent, herbaceous and slightly camphorous, with a savory backbone. Why it matters: thymol and carvacrol in thyme are powerful antimicrobials and have bronchodilatory effects. Traditional European cough syrups and inhalations use thyme for chest congestion for good reason. It helps loosen mucus and ease breathing. What's ahead? Practical steeping tips and how to pair thyme with honey and lemon for a more pleasant cup when you're congested. Here's where we'll pause this first stretch. We've covered the top of the list and framed the 2 teas I flagged up front. Clove, Distress 7, which we'll treat as a potent anti-inflammatory that requires caution, and turmeric, number 1, the bioavailability star we'll unpack in depth later. Next up, we'll go deeper into those fast-acting teas that relieve acute symptoms, move through thyme and clove with exact brewing and interaction guidance, and then shift into the tonics that reshape baseline health when consumed consistently. Before we move on, a few practical, evidence-minded rules to keep in your pocket as you try any of these tonight or this week. If you take anticoagulants, blood pressure medication, immunosuppressants or other long-term prescriptions, consult your clinician before starting regular herbal tea use. Interactions are real and important. Pregnant or nursing? Talk to your clinician before starting any of these, especially elderberry, clove and concentrated extracts. Raw plant parts can be toxic. Elderberries must be cooked. Certain roots and seeds can cause stomach upset if prepared incorrectly. Herbal. For immediate symptom relief, nausea, gut spasm, mild anxiety, a single cup brewed correctly often helps within 20-45 minutes. For physiological changes like blood pressure reduction or systemic inflammation modulation, expect weeks of daily use to see measurable differences. If symptoms are severe or persistent, these teas are adjuncts, not replacements for medical care. Now let's get tactical again. I'll guide you through precise brews, sensory cues that mean it's ready, and one simple recipe you can start tonight. How to make a ginger infusion designed to act fast on nausea and settle the stomach. For a single serving, slice a 1-inch piece of fresh ginger into thin coins. Add to 1-2 cups of cold water, bring to a gentle simmer, then simmer for 15 minutes. Strain and sip small amounts every 10-15 minutes until the nausea eases. Add lemon or a teaspoon of honey if you need flavor. If you're using ginger repeatedly, rotate with peppermint or chamomile so you're not relying on a single herb daily. And one more thing on safety. When I say consult your clinician, that doesn't mean don't try it. It means try a single cup, pay attention to how your body reacts. And if you're on medications or pregnant, get the professional okay for regular dosing. We're about to move into the heart of the list. The teas that often deliver the quickest symptomatic relief and the sensory recipes that make them genuinely pleasant to drink. I'll walk you through passion flower and chamomile in real-world combinations for sleep and anxiety. Then we'll tackle thyme and clove for chest congestion and inflammatory pain, including when to reach for a single cup and when to use these plants as part of a short course. First, a short practical pairing you can make tonight, a calming wind-down cup. Combine 1 teaspoon of dried chamomile and 1 teaspoon of dried passion flower in a tea infuser. Steep in boiling water for 12 minutes. The longer steep extracts more calming compounds. Strain and sip 30-45 minutes before bed. This mix blends chamomile's apigenin-driven muscle relaxation and passion flower's GABA-modulating profile. Randomized trials of each suggest additive benefits when you're trying to fall asleep. Coming up, exact clove steeping, how to temper its intensity so it's drinkable, and the science that explains why eugenol's effect on the COX-2 pathway can make a real difference for short-term inflammatory pain. We'll also go through thyme's bronchodilatory actions and the simple honey-thyme infusion that's been used throughout Europe for coughs. If you're already thinking about which of these you'll try first, drop the name in the comments. I'll read them and tailor the brewing demos in the next video. Next, we'll bridge the rapid relief teas to the long-term tonics. How to structure a weekly rotation so you get short-term comfort and long-term benefits without overload or interaction risk. Number 7, clove sensory opener, dark, warming, and a little fierce. 1 clove in a cup smells like a fire that wants to heal. A bit of history. Cooks and apothecaries have used clove for toothaches, sore throats, and digestive upset for centuries. It shows up in medieval wound poultices and in spice blends across Asia and Africa. What the evidence says, the key molecule in clove is eugenol, which lab work and some clinical observations show modulates the COX-2 inflammatory pathway, the same biochemical pathway many NSAIDs act on. That doesn't mean clove is identical to a pharmaceutical, but it helps explain why a clove infusion can reduce localized short-term inflammatory pain and has antimicrobial activity in the mouth and throat. How to prepare? For a single cup, use 1 to 2 whole cloves. Crush the cloves slightly with the back of a spoon to release essential oils. Add to 1 cup boiling water and steep for 10 to 12 minutes. If the flavor is too intense, temper it with a slice of orange, a cinnamon stick, or a teaspoon of honey once cooled slightly. When it helps and cautions, clove tea can give relatively fast relief for localized inflammatory pain, toothache discomfort, sore throat irritation, or post-meal digestive twinges, often felt within 20 to 40 minutes. Important safety note. Because eugenol can affect platelet function, If you take anticoagulants, blood thinners, or are preparing for surgery, consult your healthcare provider before regular use. Pregnant or nursing? Talk to your clinician first. Number 6. Thyme. Sensory opener. Savory and resinous. Thyme tastes like the herbaceous air of a kitchen garden in winter. A bit of history. European folk medicine prized thyme for coughs and chest colds. Preparations ranged from teas to steam inhalations and honey blends. What the evidence says: thyme contains thymol and carvacrol, compounds with broad antimicrobial activity and mild bronchodilatory effects. In traditional cough syrups and several small clinical formulations, thyme has been associated with faster cough resolution and easier expectoration. Mechanistically, these compounds help loosen mucus and reduce microbial load in the airways while relaxing small bronchial muscles. How to prepare? Steep 1 heaping teaspoon of dried thyme or a sprig of fresh thyme in 1 cup of boiling water for 10 minutes. Strain and sweeten with honey if desired. A squeeze of lemon adds vitamin C and flavor balance. When it helps and cautions, thyme tea is useful for acute chest congestion and coughs and can start to loosen bronchi within an hour of drinking. If you have severe asthma or are on prescription bronchodilators or inhaled corticosteroids, continue your medications and check with your clinician about adding thyme as a complementary remedy. Pregnant or nursing? Consult your healthcare provider. Number 5. Dandelion root. Sensory opener. Roasted dandelion root tastes toasty and slightly bitter, with a coffee-like backbone and a clean finish. A bit of history. Traditional herbalists worldwide have used roasted dandelion root as a digestive tonic and liver stimulant for generations, often as a coffee substitute. What the evidence says: the bitter compounds in dandelion root promote bile flow and stimulate digestive secretions, supporting fat digestion and liver function in a gentle way. Clinical evidence is limited but consistent with traditional use. People report improved post-meal bloating and sluggish digestion when using dandelion as a short course or regular tonic. How to prepare? For an infusion, use 1 tablespoon of roasted dandelion root to 1 cup of water. Bring to a simmer and steep for 15 minutes, then strain. For a stronger decoction, simmer for 20 minutes, because some active constituents are less water-soluble. A longer simmer extracts more bitterness and activity. When it helps and cautions, dandelion root is best as a routine digestive support rather than an instant fix. Expect improved digestion over days to weeks when used consistently. If you have gallstones or bile duct obstruction, or if you take cholagogues or bile-affecting medications, check with your healthcare provider before regular use. Pregnant or nursing? Talk to your clinician first. Number 4. Lavender. Sensory opener. Pale, perfumed and softly floral. Lavender tea is like a meadow exhaled into a cup. A bit of history. Lavender's calming reputation goes back to Roman baths and medieval apothecaries. People use the flowers for sleep, anxiety, and headache relief. What the evidence says: standardized lavender preparations, including oral extracts, have shown anxiolytic effects in randomized trials. The likely mechanisms include modulation of neural excitability via calcium channel and GABA-related pathways. In plain terms, lavender calms the overactive neurons that underlie stress and tension. For tea, the effect is generally milder but still meaningful for many people. How to prepare? Steep 1 teaspoon of dried lavender flowers in a cup of boiling water for 8 to 10 minutes. Taste before sweetening. A little honey or lemon can round the floral notes. When it helps and cautions, lavender tea is helpful for nervous tension and can support sleep onset within 30 to 60 minutes for many users. If you're taking sedatives or medications with central nervous system effects, consult your provider because effects can be additive. Pregnant or nursing? Check with your clinician. Some practitioners advise caution in early pregnancy. Number 3. Rooibos. Sensory opener. Warm, coppery, and naturally sweet, rooibos is velvet on the palate with subtle, nutty undertones. A bit of history. Indigenous to South Africa, rooibos has been a staple brewed beverage for centuries and was traditionally used as a caffeine-free alternative with restorative properties. What the evidence says: rooibos contains unique antioxidants, including aspalathin, which laboratory and animal studies suggest can improve markers of oxidative stress and influence glucose metabolism. Human studies are preliminary but promising for supporting metabolic health and reducing oxidative damage when consumed regularly. How to prepare: steep 1 to 2 teaspoons of loose rooibos or 1 tea bag in boiling water for 7 to 10 minutes. Rooibos holds up to long steeping without bitterness, so adjust strength to taste. When it helps and cautions: rooibos is a long-term supportive tea. Benefits for blood sugar regulation or oxidative stress accumulate with regular intake over weeks to months rather than overnight. It's caffeine-free, making it an excellent daily base for people avoiding stimulants. If you have specific liver conditions or are on medications that influence glucose, check with your clinician before making it a staple. Number 2. Nettle. Sensory opener. Green, mineral, and slightly vegetal. Nettle tea tastes like a fresh garden bite in a cup. A bit of history. Nettle leaf has a long history as a nutrient-dense tonic in Europe and Asia, used for seasonal allergies, joint complaints, and men's urinary health. What the evidence says: clinical trials suggest nettle leaf can reduce symptoms of benign prostatic hyperplasia, BPH, and has anti-inflammatory properties useful for seasonal allergic rhinitis. The leaf is rich in minerals and polyphenols. Its anti-inflammatory actions include modulation of cytokines and other immune mediators. How to prepare: steep 1 to 2 teaspoons of dried nettle leaf, or a generous handful of fresh leaves if you harvest them safely, in boiling water for 10 minutes. Strain and drink, warm or chilled. When it helps and cautions: nettle works as a nutritive tonic and anti-inflammatory support over time. Expect incremental benefits with regular use across weeks. Nettle may affect blood pressure and blood sugar, so if you take antihypertensives, diuretics, or diabetes medications, consult your healthcare provider before regular use. Pregnant or nursing. Talk to your clinician first. Don't give nettle to children without pediatric guidance. Number 1. Turmeric, curcumin. Sensory opener. Earthy, a touch bitter and golden. Turmeric tastes like sunlit root translated into warmth. A bit of history. Turmeric has been a central anti-inflammatory and digestive spice in Ayurvedic and Southeast Asian traditions for millennia, used in food, poultices, and tonics. What the evidence says: curcumin, turmeric's primary bioactive pigment, shows anti-inflammatory and antioxidant activity across hundreds of studies. However, curcumin on its own is poorly absorbed. The clinical punch comes when you dramatically increase its absorption by combining it with black pepper, piperine, and a small amount of fat. Piperine slows the liver's breakdown of curcumin and increases circulating levels substantially, while fat helps curcumin dissolve and be taken up in the gut. Randomized trials and meta-analyses suggest curcumin preparations can reduce markers of systemic inflammation and offer symptomatic benefit for joint pain and inflammatory conditions when taken consistently. How to prepare: golden milk is a reliable, pleasant way to consume bioavailable curcumin. For one serving, warm 1 cup of milk, dairy or plant-based, with 1 teaspoon of ground turmeric or 1 tablespoon freshly grated root, 1/8 teaspoon of freshly cracked black pepper or a generous pinch, and 1 teaspoon of coconut oil or butter. Simmer gently for 5 to 10 minutes to let the compounds meld. Whisk or blend for a creamy finish and strain if you used fresh root. Sweeten lightly if desired. When it helps and cautions: turmeric is primarily a cumulative supporter of systemic inflammation. Expect measurable changes over weeks to months of regular use, though some people report immediate warmth and digestive comfort after a cup. Important safety note. If you take anticoagulants, certain diabetes medications, or have gallbladder disease, consult your healthcare provider before starting regular turmeric supplementation. Pregnant or nursing, talk to your clinician. Culinary amounts are generally considered safe, but concentrated, regular medicinal doses should be supervised. Brews and how-to practical demos, concise, actionable steps. Elderberry simmer. Use 1 cup dried elderberries to 3 cups water. Combine in a pot, bring to a boil, then reduce to a gentle simmer for 20 to 30 minutes. Mash the berries to release juice, strain through a fine mesh, and sweeten if desired. Use syrup within a few days, refrigerated or freeze portions. Cooked elderberry is safe. Raw elderberries, leaves or stems can be toxic. Turmeric golden milk. Warm 1 cup milk with 1 teaspoon ground turmeric or 1 tablespoon fresh. A pinch of black pepper, 8 teaspoon, and 1 teaspoon fat, coconut oil or butter. Simmer 5 to 10 minutes. Whisk and strain if needed. Drink daily or every other day for systemic support. Ginger infusion for nausea. Slice a 1-2-inch piece of fresh ginger into thin coins and simmer in 1 to 2 cups of water for 15 minutes. Strain and sip small amounts every 10-15 minutes until nausea eases. Add lemon or honey to taste. Hibiscus iced brew. Steep 1 to 2 heaping teaspoons of dried petals per cup in boiling water for 5 to 10 minutes. Then chill. Drink 2 to 3 cups daily as a consistent habit for blood pressure support, and discuss with your clinician if you take antihypertensive drugs. Clove cup that's drinkable. Use 1 crushed clove per cup. Steep 10-12 minutes. To temper intensity, add a thin orange peel or a cinnamon stick during steeping and sweeten lightly. Thyme and honey cough infusion. Steep 1 teaspoon dried thyme in 1 cup boiling water for 10 minutes. Strain into a mug and stir in a teaspoon of honey. Sip frequently for chesty coughs and congestion. Chamomile plus passion flower wind down. Combine 1 teaspoon chamomile and 1 teaspoon passion flower. Steep 12 minutes. Sip 30-45 minutes before bed. Safety, interactions, and smart rules. Herbs are pharmacologically active. If you take anticoagulants, blood thinners, antihypertensives, immunosuppressants, diabetes medications, or other long-term prescriptions, consult your healthcare provider before starting regular herbal tea use. Pregnant, nursing, or considering giving these to children? Talk to your clinician first. Cook elderberries fully. Never eat raw elderberries, leaves or stems. Use caution with concentrated extracts. Teas and culinary doses are gentler, but concentrated tinctures or high-dose supplements can have stronger effects and interactions. Watch for additive sedation. Chamomile, passion flower, lavender and other calming herbs can increase the effect of prescription sedatives. Discuss this with your prescriber. If you experience any allergic reaction, rash, swelling, difficulty breathing, stop use and seek medical attention. When in doubt, test a small cup first and wait a few hours to see how you respond before making a tea part of your daily routine. How to build a simple weekly rotation. Practical plan. Pick 2 immediate relief teas and 2 tonic teas. Example, morning golden milk, turmeric for baseline inflammation support, midday rooibos or nettle as a nutritive cup, peppermint or ginger after meals is needed, and chamomile plus passion flower at night for sleep. On respiratory days, add elderberry and thyme. For acute inflammatory pain, add a clove cup and pair with rest and ice heat as appropriate. Rotate herbs across the week, rather than relying on a single plant daily for months. This reduces risk of tolerance and exposure to any single constituent. Sample week. Daily. Turmeric golden milk in the morning, or every other morning. Every day. Rooibos or nettle as a second cup, as needed after meals, peppermint or ginger. At night. Chamomile plus passion flower wind down every other night. Acute days, elderberry syrup course for early viral symptoms, thyme and clove as short courses for cough or localized inflammatory pain. Keep records. Note which tea, what time, and any effects. That helps you and your clinician evaluate benefit and safety. Sourcing, quality, and practical tips. Choose whole herbs or reputable brands with clear sourcing. Organic or pesticide-tested products reduce the risk of contaminants. For roots and barks, ensure you're using the correct plant part and prepare as recommended. Many roots benefit from longer simmering. Store dried herbs in a cool, dark place and use within a year for peak potency. If you're buying extracts or concentrated blends, check the concentration and avoid proprietary blends that don't list active ingredient amounts. When in doubt, consult a trained herbalist or your clinician. When to seek medical care. If symptoms are severe, rapidly worsening, or accompanied by high fever, blood in sputum, fainting, chest pain, severe dehydration, or persistent vomiting, seek urgent medical attention. These teas are complementary tools, not replacements for emergency care or necessary prescription therapy. Final synthesis, what instantly means here. The title promised instantly, and the reality is nuanced. Several of these teas can provide relatively rapid symptomatic relief. Ginger, peppermint, clove, thyme, chamomile, and passion flower are examples you can reach for when you need fast comfort. Nausea can calm within 20 to 30 minutes. A crampy gut twinge or mild headache can ease within a half hour. And throat soreness or mild tooth discomfort can soften after a clove cup. Elderberry, when used early in a respiratory illness, has been associated in trials with shortened symptom duration, a short-term targeted intervention rather than a miracle cure. Other teas are best thought of as cumulative tonics. Hibiscus for blood pressure support, turmeric for systemic inflammation, rooibos for antioxidant support, nettle and dandelion for nutritive and digestive maintenance. These build measurable changes over days to weeks of consistent use. Use the short-acting cups for immediate comfort and the tonic cups as part of a daily rhythm. Always respect interactions and special populations. If you take anticoagulants, blood pressure meds, immunosuppressants, or other chronic prescriptions, consult your healthcare provider before starting regular use. Pregnant, nursing, or giving these to children. Talk to your clinician first. One last practical nugget: flavor makes adherence. If a medicinal tea tastes punishing, you won't drink it consistently. Use small tweaks. A squeeze of citrus, a cinnamon stick, a splash of milk, or pairing a bitter root with a warming spice to make these cups something you look forward to every day. Which of these 13 will you try first? Drop the name of the tea in the comments and tell me what symptom or goal you're aiming for. I read them, and I tailor the next brewing demo to what you want to see. If this guide helped you, share it with a friend who reaches for tea when they need relief, and subscribe for the upcoming step-by-step brewing videos that walk through the exact visual cues and simmer times so you can get the most from every cup.